Most people believe that exercise always lowers blood pressure, that every walk, every workout, every time you push yourself physically, your heart gets healthier and your numbers get better. So if your doctor told you to exercise more, you're doing the right thing, right? Not always. And for people over 60, what happens to your blood pressure during and immediately after exercise could be one of the most important and most overlooked pieces of cardiovascular information your doctor has never once discussed with you. That is exactly what we are covering today. I'm Dr. Ryan Foster. I'm a cardiologist and I've been in clinical practice for over 2 decades. I have sat with patients in the recovery room after cardiac events, patients who were doing everything right, taking their medications, eating well, exercising regularly, patients who had no idea that the very activity they believed was protecting their heart was under the wrong conditions, triggering dangerous pressure spikes they could not feel and nobody was measuring. These are men and women who walked into a gym feeling fine. Men and women who finished a morning jog, came home, made breakfast, sat down and never got back up. Exercise is not the enemy. I want to be completely clear about that from the beginning. Exercise is one of the most powerful cardiovascular medicines available to any human being on this planet. But like every powerful medicine, it comes with a dosage, a timing, and a set of conditions that determine whether it heals you or harms you. After 60, those conditions change, and most people are never told exactly how. Here is the core problem with how exercise and blood pressure are typically discussed. Your doctor checks your blood pressure at rest. At a clinic, sitting quietly in a chair after you've been waiting in a waiting room for 20 minutes. That resting number is what your entire cardiovascular assessment is based on. But your heart does not live at rest. Your blood pressure does not stay in that chair. The moment you stand up, walk to your car, climb a flight of stairs, or begin any form of physical activity, your cardiovascular system responds. And for millions of people over 60, that response is happening in ways that are neither measured nor monitored. The question is not just what your blood pressure is when you are sitting still. The question is, what is your blood pressure doing when your body is actually working? Under normal conditions, here is what happens to blood pressure during exercise, and it is genuinely remarkable. The moment you begin physical activity, your muscles demand more oxygen. Your heart responds immediately. It beats faster, it pumps harder, it drives more blood through your arteries with greater force. Your systolic blood pressure, the top number, rises. During moderate exercise, it can climb from a resting level of around 120 to anywhere between 150 and 180 millimeters of mercury. That is normal. That is expected. That is your cardiovascular system working exactly as it was designed to work. We call this the exercise pressure response. It is not a problem. It is physiology. But here is what changes after 60, and this is the part that matters enormously. As we age, our arterial walls gradually stiffen. The elasticity that allowed blood vessels to expand and absorb the increased pressure of exercise begins to diminish. Your autonomic nervous system, the one regulating how your heart and vessels respond to physical demand, loses some of its precision and its speed. The result? The same workout that produced a moderate, well-controlled pressure rise at 45 can produce a significantly more extreme and prolonged spike at 65. And the recovery, the return to normal resting pressure after exercise takes longer, much longer than most people realize. There is something else, and this surprises almost everyone I tell it to. For some people, blood pressure does not just rise during exercise. It rises after exercise has stopped reaching its peak, not during the workout itself, but in the 30 to 60 minutes that follow. You finish your walk, you sit down, you feel fine, and that is precisely when your systolic pressure may be at its highest point of the entire day. This is called the Post-Exercise Hypertensive Response, and it is almost never discussed in a standard medical appointment. Let me give you a real clinical example. A patient comes in, 71 years old, active, motivated, takes his health seriously, resting blood pressure 128/76. His doctor is pleased. He is pleased. By every standard measure, he is doing well. He walks on a treadmill for 30 minutes at a moderate pace. He finishes. He sits down to cool off. He feels perfectly fine. I have a continuous monitor on his arm during this entire process. At minute 40, 10 minutes after he stopped walking, his systolic pressure reads 194/108. That is not a moderate elevation. That is a hypertensive crisis occurring in a man who felt perfectly comfortable drinking a glass of water and reading a magazine. At minute 45, it had not come down. At minute 60, it was still at 178. How does something like this happen? There are three primary mechanisms, and each one becomes significantly more relevant after the age of 60. First, arterial stiffness. His vessels cannot absorb and redistribute the elevated pressure efficiently after the physical demand stops. The pressure has nowhere to go and it stays elevated. Second, a delayed catecholamine response. His adrenaline and stress hormones, released during the exercise, do not clear from his bloodstream as quickly as they did 20 years ago. They continue driving his heart harder and his vessels tighter well after the physical effort has ended. Third is medication timing. He takes his antihypertensive in the morning. By late afternoon when he exercises, its protective window has partially closed. The medication is working, but it is working at half strength during the exact window when his cardiovascular system faces its greatest daily demand. Same man, same medication, same exercise. Different time of day, dramatically different outcome. We have a clinical term for this pattern, an exaggerated exercise blood pressure response. And the numbers are significant. Studies show that among adults over 60 with otherwise well-controlled hypertension, nearly 1 in 3 experiences an exaggerated pressure response during or after moderate exercise, with systolic readings exceeding 210 millimeters of mercury at peak. Not during intense training, during moderate activity. And research is consistent on what this predicts. An exaggerated exercise blood pressure response is independently associated with a significantly higher risk of future cardiovascular events, including heart attack and stroke, even in patients whose resting blood pressure appears completely normal. Normal at rest. Dangerous under load. Standard office visits catch none of this. None. Zero. That is the diagnostic gap we need to close, and today I am going to show you exactly how to close it. Now let us talk about the things already in your daily exercise routine that may be silently making this worse. You will be genuinely surprised by at least one of them. The first hidden factor is exercise timing, specifically exercising in the early morning before 9 a.m., without allowing your cardiovascular system to properly transition from its overnight state. During sleep, your body runs in a low-demand, low-pressure mode. Your heart rate slows, your vessel tone changes. Your stress hormone levels, cortisol and adrenaline, are at their lowest. Between 6 and 9 in the morning, those hormones begin their natural daily rise. Blood pressure climbs gradually as your body prepares for the day. This morning surge is normal, but it also means that your cardiovascular system is already under an elevated hormonal load before you take a single step on a treadmill. For people over 60 on blood pressure medication, exercising during this early morning hormonal surge before the medication has reached its peak effectiveness can produce pressure spikes that are significantly larger than the same workout performed 3 hours later. The timing of your workout matters as much as the workout itself. The second hidden factor is isometric breath holding. This one catches almost everyone off guard. Many people naturally hold their breath during moments of physical effort, lifting grocery bags, getting up from a low chair, climbing stairs with packages. This is called the Valsalva maneuver. It is instinctive, and in healthy younger adults, it is brief and harmless. In adults over 60 with any degree of arterial stiffness, a sustained Valsalva maneuver can cause a rapid and dramatic spike in blood pressure, a surge that happens faster than any medication can respond to, and faster than you can feel it coming. Check yourself honestly. Do you hold your breath when you exert yourself? If the answer is yes, that habit, not your medication, not your diet, may be the single most important thing to change this week. The third hidden factor is post-exercise caffeine. Specifically, coffee or caffeinated beverages consumed within 30 to 45 minutes after finishing exercise. After exercise, your blood vessels are already working to manage the elevated pressure of the post-exercise recovery period. Caffeine, a vasoconstrictor, narrows vessel walls at precisely the moment your cardiovascular system is trying to bring pressure back down. The combination extends the post-exercise hypertensive window significantly, and in people over 60 can push an already elevated recovery pressure into genuinely dangerous territory. The timing of your coffee matters more than most people ever consider. So how do you actually find out whether your blood pressure is responding safely to exercise? There are 3 things you can bring to your next appointment, and almost certainly none of them have ever been discussed with you. The first is an exercise stress test with continuous blood pressure monitoring. This is not a standard stress test for detecting blockages. This is specifically requesting that your blood pressure be recorded at every stage during exercise and during the full recovery period afterward. Ask specifically, I want my blood pressure monitored throughout the entire recovery phase. That recovery phase is the critical window most tests ignore. The second is a post-exercise blood pressure reading at home. This is something you can begin tonight. Take your home blood pressure cuff. Exercise at your normal intensity. Sit down immediately after and take readings at 10, 20, and 30 minutes post-exercise. Write down the numbers. Bring that log to your doctor. That simple 3-reading log will give your physician more meaningful information about your real cardiovascular response than a year of resting office readings. The third test is an arterial stiffness assessment, also called pulse wave velocity testing. This measures how efficiently your arterial walls absorb and transmit pressure. It is one of the strongest independent predictors of exercise-related cardiovascular risk. It is non-invasive, widely available, and almost never ordered unless a patient specifically requests it by name. Write these down right now. Exercise stress test with full recovery monitoring. Post-exercise home blood pressure log. Pulse wave velocity. That is your complete agenda for your next appointment. Now, practical solutions, starting with the most immediately actionable one. Shift your workout window. If you currently exercise before 9 a.m., consider moving it to mid-morning between 10 and 11. Allow your morning cortisol surge to peak and begin declining. Allow your blood pressure medication to reach its full therapeutic effect. That 2-hour shift for the right patient can reduce the peak exercise blood pressure response by a clinically meaningful margin. Talk to your doctor before making this change, particularly if your medication is specifically timed. But the conversation is absolutely worth having at your next appointment. Practice pressure breathing during exercise. Specifically exhale during the moment of exertion. When you stand up, when you lift, when you push, breathe out. Do not hold. This single habit eliminates the Valsalva response and removes one of the most controllable triggers of acute pressure spikes during everyday physical activity. It takes 3 days to build the habit. It takes 1 cardiac event to wish you had. Time your post-exercise window deliberately. For 30 to 45 minutes after any meaningful physical activity, no caffeine, no heavy meals, no sudden positional changes. Sit quietly. Hydrate with water. Allow your cardiovascular system to complete its recovery without adding additional vasoconstrictive demand. This is not a complicated protocol. It is 45 minutes of informed patience that your heart has earned. I want to tell you something that I carry with me from over 2 decades in this field. I have spoken with families after events that happened during exercise, after morning runs and afternoon walks, after gym sessions that began with perfect intentions. I remember every single one of those conversations, and in a significant number of those cases, the information that could have changed the outcome already existed. It existed in an unmonitored recovery phase, in a post-exercise reading nobody ever took, in an exaggerated response pattern that a simple home log would have revealed months earlier. Medicine is humbling. Not every outcome is preventable, but far more are preventable than people believe when the right questions get asked at the right appointment by a patient who walked in prepared. You're not being demanding when you ask your doctor about your post-exercise blood pressure. You're not being difficult when you request a recovery phase stress test. You're being a responsible, informed participant in your own cardiovascular care. That distinction matters enormously. The patients who bring lists, the patients who ask specific questions, the patients who follow up, they consistently receive better care. That is not an opinion. It is a clinical observation I have made across thousands of patient interactions. You now have specific questions, specific tests, specific habits to change. That is real measurable value you can walk into your next appointment with. Let me bring everything together clearly. Exercise raises blood pressure that is normal and expected. But after 60, arterial stiffness, slower hormonal clearance, and medication timing can push that response into genuinely dangerous territory, particularly in the 30 to 60 minutes after exercise ends. Nearly 1 in 3 adults over 60 with controlled hypertension experiences an exaggerated post-exercise pressure response. Almost none of them know it. 3 hidden factors in your routine may be making this worse right now. Early morning exercise timing, breath holding during exertion, and post-exercise caffeine. 3 steps you can take this week. 1. Take your blood pressure at 10, 20, and 30 minutes after your next workout. Write the numbers down. That log is your most important clinical document. 2. Practice exhaling during moments of physical exertion starting today. Every time you stand, lift, or push, breathe out. Do not hold. 3. Write down these 3 test names. Exercise stress test with full recovery monitoring. Post-exercise home blood pressure log. Pulse wave velocity. Bring that list to your next appointment. Has your doctor ever discussed your post-exercise blood pressure with you? Have you ever had a recovery phase reading taken? Tell me in the comments below. I read every single one, and your experience genuinely helps others know exactly what questions to bring to their physician. If this video gave you something useful today, please share it with one person over 60 who exercises regularly. This is precisely the kind of information that falls between appointments and referrals, and your share can be the bridge someone needs. Subscribe to Dr. Ryan Foster if you want to go deeper on cardiovascular health after 60. There is much more critical ground to cover, and we are just getting started. One final thing, and I want to be completely direct. Everything shared today reflects current clinical research and my experience in cardiovascular medicine. It is educational information, not personal medical advice. Your situation is specific. Your medications are individual. Your history is unique. Before changing your exercise timing, before adjusting your medication schedule, before beginning any new protocol, talk to your own physician. That conversation is not a formality. It is the entire point. Better information, better conversations, better outcomes. Your heart has been working for you faithfully every second of every hour of every year of your life, without pause, without rest, without complaint. The very least we can do is pay attention. Walk into your next appointment prepared. Walk in with your list. Walk in knowing what to ask. That changes everything. I will see you in the next video. Until then, take exceptional care of yourself and of the people you love.